Introducing the StatLock CV Plus Stabilization Device, a suture-free alternative for stabilization of central venous catheters. The StatLock CV Plus Stabilization Device is clinically proven in published studies to reduce overall CV catheter complications. With the StatLock CV Plus Stabilization Device, the risk of you contracting HIV, hepatitis B, or hepatitis C from an accidental suture securement needle stick is eliminated. The StatLock CV Plus Stabilization Device is an evidence-based method of catheter stabilization that meets the 2006 INS standards. In fact, OSHA also recommends consideration and implementation of available, effective, and safer medical devices to reduce the potential for needle sticks by eliminating the need to suture medical catheters. Please watch and listen closely to this brief instructional video so that both you and your patients can enjoy the use of this StatLock device. Applying the StatLock CV Plus Stabilization Device is as simple as prep, press, peel, and place. Notice that the insertion site and securement site are separate in distinct locations. Care of the insertion site should be in accordance with your institution's policy and procedure, and does not change with the use of StatLock stabilization devices. Preparation of the securement site should proceed as follows. After the central venous catheter has been inserted per the manufacturer's instructions, carefully clean the skin of blood and fluid. Then prep the entire securement area with 1 to 2 alcohol pads in order to cleanse and degrease the skin, and to remove any betadine, oils, or lotions if present. Allow to dry completely. Next, and very important for skin protection and enhanced adherence, apply the provided skin protectant pad and allow it to dry completely for 10 to 15 seconds. Finally, apply a tincture of benzoin and allow it to dry, tachy-dry. Proper skin preparation is essential to the success of the StatLock CV Plus Stabilization Device. So remember, first alcohol, then skin protectant, then tincture of benzoin, and remember, when using each product, allow each to dry completely. Now, place the suture holes of either the stationary wing or the movable wing of the catheter over the StatLock device posts and press the lids closed. Finally, peel away the StatLock device paper backing one side at a time and apply the StatLock device anchor pad to the patient's skin. Always secure the catheter to the StatLock device before applying it to the skin to avoid exerting undue pressure on the patient. If the StatLock device pigtail retainer is provided, secure pigtails by gently stretching them into place. The central venous catheter is now secure and without risk of suture wound infection. The StatLock CV Plus Stabilization Device should be monitored daily and changed when clinically indicated, at least every 7 days. In most ICU settings, the StatLock CV Plus device will stay secure an average of 4 to 5 days. Before removing the StatLock CV Plus device, clinicians are strongly advised to take the following 3 measures to avoid inadvertent dislodgement or migration. First, apply the sterile adhesive strip at or near the insertion site. This will provide temporary securement during the interval between removal and replacement of the StatLock CV Plus stabilization device. Second, if at all possible, place the patient in a horizontal or near horizontal position. And third, take the tension off the catheter pigtails using tape or the StatLock device pigtail retainer if provided. Disengage the catheter from the StatLock retainer by first stabilizing the catheter, then opening the StatLock device lids and lifting the catheter. All StatLock devices have a custom formulated adhesive that is alcohol soluble. Therefore, to remove the StatLock device anchor pad, simply take 3 to 4 alcohol pads and squeeze a generous amount of alcohol near the edge of the pad. Then lift the corner and gently stroke the undersurface of the pad while continuing to lift. The StatLock CV Plus stabilization device is that easy. For application, prep, press, peel, and place. For removal, disengage and dissolve. Protect yourself from accidental needle sticks by eliminating the need for suture securement with the StatLock CV Plus stabilization device, the faster and easier catheter securement method.